we also talk about the side effects, of course, that could happen with the naltrexone injection. And those are the same as for the oral naltrexone, and that can be some nausea. It can also be some diarrhea or any kind of type of stomach or GI issues, and also can sometimes cause a little bit of a headache. There's also a very small risk that it could increase depression or suicidality. And so that can sometimes be something that the psychopharmacologist really needs to talk with the patient about, especially if the patient has a history of depression. It's a very rare side effect, but it's important. And then the last one that's very different from taking the oral medication and taking the injection is an injection site reaction. And so what can happen often after the injection, it's a pretty big injection. It's 4 milliliters. And so that can be a lot of fluid for your muscle to absorb. And so sometimes that area can get warm or feel really painful for a couple of days afterwards. Most of the time what we tell people is to ice it. And that tends to really decrease that injection site reaction. And it's rare that that reaction would cause someone to not be able to get the injection ever again. Most of the time it's just like a flu shot where it's a little bit sore, the muscle's a little sore for a couple days after, but it's relatively mild.